Hi guys, so today I will be presenting about seizure disorders and all the different kinds that there are. So the first one I want to talk about are focal onset seizures. So focal onset seizures are seizures that happen in a specific part of the brain. So rather than it affecting all of your brain, it will just happen in one part of it. And so there's different variations to focal onset seizures. So for instance, there's a focal aware seizure, and that happens when a person is alert and awake, so they know that they're having a seizure while it's happening and after it happened. Whereas focal onset impaired awareness seizure will happen when a person is out of it, confused, and they're just not aware of their surroundings or about what just happened regarding their seizure. Okay, so symptoms for focal seizures. So, focal seizures will tend to cause motor symptoms. So, what that means is it will include tensing of muscles, weak limbs, body spasms. And however, there are also what you call absence seizures. So what happens is during absence seizures, you will not have any motor symptoms. Rather, you'll have more minor symptoms like the twitching of eyelids. So you won't feel the full force of the symptoms that seizures carry. Okay, the next kind of seizure I want to talk about are generalized seizures. So they're the complete opposite of focal seizures. So what happens is it'll affect both sides of your brain and all of your brain. And one that I want to talk about are generalized tonic-clonic seizures. So these are actually the most common type of generalized seizures. So there's two phases to it. There's a tonic phase and the clonic phase. So during the tonic phase of the seizure, you'll feel stiffening of the limbs, and they're followed of spasms from the limbs and the face. And this part of the phase will usually last about a minute. And then there's the clonic phase, and during the clonic phase, you're still spazzing out a bit, but then your muscles will begin to start relaxing until all the spasms cease and you're done with your seizure. But okay, not everyone will experience both phases of a tonic-clonic seizures. Some will experience only the tonic phase, while others might just experience the clonic phase. Really just depends on you and the kind of epilepsy or seizure disorder that you might have. Furthermore, there's what you call myoclonic seizures. So myoclonic seizures happen really suddenly, very quickly, and what you'll experience is repeated contractions of body muscles. And then what tonic seizures are, there's the complete opposite. So what happens, you'll lose muscle tone, eventually you'll go limp, and these can be very, very dangerous because they're very abrupt, and since you go limp, you can collapse anywhere, and this can possibly lead to injuries or possible head damage, and it can just be very bad. So symptoms of these kind of seizures can include exhaustion, muscle contractions, changes in breathing, body spasms, and confusion. So, causes for seizures. So, causes for seizures are honestly just anything that can disturb brain function, so brain infection. So what happens is seizures will result from swelling and pressure in the brain caused by bacterial toxins in your brain, and this leads to the seizures. And then there's also other side effects like drug abuse, electric shock, brain defects at birth, strokes, and epilepsy. And epilepsy is just a specific type of seizure disorder. So one of the most commonly asked questions is, can seizures cause brain damage? So the answer is yes. So using animal models, scientists were able to figure out that, in fact, using animal and clinical imaging, the studies showed that, in fact, seizures can cause brain damage. So what happened is they inspected these animal brain models, and they showed that while these animals had violent limbic seizures specifically, it resulted in damage to the hippocampus part of the brain, and this was actually also evident in humans. And what happens is the hippocampus begins to enlarge and it just hyperintenses until eventually it just becomes very damaged. Furthermore, more studies showed that generalized seizures cause progressive brain damage in people who have epilepsy that affects their temporal lobe, specifically in other parts of the brain such as the amygdala, piriform cortex, and the cerebral cortex and thalamus. And it affects these a little less, but it'll still affect the brain. And this is just a diagram showing parts of the brain that are affected by seizures. So, treatments for epilepsy. So you'll have your general typical treatment that is usually given to people first. So you'll have your medication, which is used and helps stabilize electrical activity in the brain, and most will take medication every day just so that it allows to regulate their seizures, and it's actually effective for most people. It'll usually help about 7 in 10 patients, and they'll respond well to medication. However, it's important to keep in mind that medication cannot cure your epilepsy or any sort of seizure disorder that you have. It can only control it and regulate however many times you have it, but medication will be assigned to a patient based on a few factors such as their age, their type of epilepsy, or possible side effects caused by medication. However, some people are drug resistant because they have drug resistant epilepsy. So for those kinds of people, there are other options for treating their seizures. So these can include surgery. So with surgery, that will remove the specific part of the brain where epilepsy is prominent. The thing is, this will normally only work for people who have focal epilepsy because that part of the brain will usually get removed. So for those people who do not qualify for surgery, there's other options like the ketogenic diet. So the ketogenic diet is a very high in fat diet, low in protein with little to no carbohydrates, and it's typically used for patients with hard to control seizures and patients who do not respond well with epilepsy. And of course, although we have all these current treatments, there are new treatments being studied closely for people with epilepsy. One of those includes gene therapy. So gene therapy works by injecting specific genes into the affected cell. So what this does is it works by replacing affected and mutated cells or by inhibiting certain processes that are the root of a problem. For example, in epilepsy, genes such as the Y-aminobutyric acid are transferred into the part of the brain that the seizures are occurring in. This gene works by injecting neurons that produce that Y-aminobutyric acid into the original neural system of the brain, and which in turn reduces or inhibits seizures from occurring. By injecting this Y-aminobutyric acid, the brain has the ability to produce more of this acid-producing neuron, which are generally lacking in people with epilepsy, so it makes it perfect for creating a treatment for it. And then furthermore, scientists are closely studying viral vectors. So what viral vectors are is they ensure that gene expression is long-term. One that they are closely studying is galanin. So galanin is a neuropeptide that can be found in many parts of the hippocampus, a part of the brain that is targeted by seizures. So galanin is very abundant in the part of the brain where epilepsy commonly occurs, which makes it one of the best candidates for injection of seizure inhibiting genes. So apart from gene therapy, there's also what scientists are studying called laser therapy. So what laser therapy is it works by sending laser energy with low voltage to the target area, and then the laser energy is turned into thermal energy, which in turn destroys a problematic tissue. And laser therapy is a good alternative for those who do not wish to go under surgical procedures. And then there's physical exercise, and it is a supplemental treatment, but it has been shown to reduce seizure frequency. So these new methods have potential in increasing the quality of life for people with disorders such as epilepsy.